I'm just wondering how the council is working with like the government or the our regional PhD team to ensure that we're tackling like rumors or some form of hesitancy towards like around amongst people of BNME community.
Well, I think it's been really. I mean, again, I know you're obviously aware of this,
Yes.
and I've had a look at your website, by the way, and you've done some really interesting stuff, which I thought was fab, actually. So I know we're not supposed to be talking about that today, but I was just going to say I thought your website was brilliant. Um, One of the really interesting things about COVID is that probably for the past year, and it is a year now, isn't it? Nearly. I was thinking about this the other day, and I was thinking, gosh, I can't believe it's been this long.
Yes.
Is that obviously the council, the local authority, and public health have been absolutely in the front of tackling the virus. And so all the kind of local outbreak control plans, how we've been working in communities to get the messages out about COVID as an infection, about how important it is to self-isolate, all that kind of thing. And what's interesting about the vaccination program is it's because it's led by the NHS, so it's led through the kind of primary care system and with the integrated care system at a West Yorkshire level. It's quite prescribed by central government in terms of the influence that we have in terms of the rollout. So I suppose that's an important thing to say because it's quite a strange position to be in where I'm getting performance information about the vaccine
Yeah.
uptake, but it's not something that I'm directly in control of in terms of how we get that administered, because obviously it's quite a clinical program, which I guess makes sense. And I know that the NHS are doing a fantastic job. So one of the main roles that the council has had has been to try and support the primary care networks to set up their vaccination sites and to make sure that they are, COVID secure and that they've got the right infection prevention and control measures in, and also to help setting up the mass testing site at John Smith Stadium.
Yeah.
And we've also put staff in to do some of the meeting and greeting and all of the stuff in terms of making people feel at ease. But obviously, as you've rightly pointed out, that assumes somebody's going to turn up when they've been asked to come for an appointment. And what we know at the moment is that I'm getting information about people that have had the vaccine, but what I don't know is how many people have been offered it and has then refused it, which makes it quite hard to understand what some of the barriers might be. So I tend to rely on, just like you've said, people who've had conversations with individuals to find out what some of the issues are. I think that there's a difference for me between hesitancy and refusal. I think there are some people within our communities and different people who are just will not accept the vaccine. And that could be because they are potentially they don't believe that COVID exists. So we've got some people like that across our community. And then we've got some people who are probably worried about the safety of the vaccine
Yes.
and wouldn't have it. But then I think there's a bigger cohort, and I'd be interested to know if you think this is reflected in the conversations that you've had, where they've probably just hesitant. So a kind of automatically generated letter from the NHS or a text that says you are eligible for your vaccine, come in now. They want to be able to feel like they can have a conversation with someone about some of the things that they're concerned about so that actually they can address some of those concerns and feel a little bit more at ease. And then they probably would come and have the vaccine.